Welcome to Science Force, where science comes alive. The fluoride paradox, from protector to threat. Hello and a very warm welcome to this explainer. Today we are diving straight into a really fascinating yet quite serious topic, the dual nature of fluoride. We usually just think of it as that stuff in our toothpaste giving us healthy smiles, right? But there's actually a much darker side to the story. Fluoride is a true paradox. In the right amounts, it's a protective shield for our teeth. But in excess, it literally transforms into a silent biological destroyer. Agenda. Here is a quick look at our agenda for today. The fluoride paradox, from protector to threat. Journey through the body, tracing the biological pathway. Clinical manifestations, how it alters the human body. Diagnosis and grading, identifying the damage. Treatment and prevention, managing the irreversible. India's burden, the massive public health crisis. 1. The fluoride paradox. This is where a protector becomes a very real threat. At its absolute core, fluoride, or F-, is just the ionic form of the element fluorine. It's a natural halogen ion found right in the Earth's crust. As groundwater flows through rocks containing minerals like fluorite and fluoroapatite, the fluoride naturally dissolves right into the water. The benefit. In small, appropriate amounts, this is absolutely brilliant. It beautifully prevents dental caries and makes our tooth enamel highly resistant to acid attacks. It's a key player in normal bone and tooth mineralization. The tipping point. The absolute tipping point is 1.5 milligrams per liter. The World Health Organization, WHO, strongly warns that when the concentration in our drinking water crosses this exact threshold, it totally stops being a protector. Instead, your risk of developing a severe chronic condition known as fluorosis just skyrockets. 2. Journey in the body. Let's trace the biological pathway of exactly how this happens. Fluoride sources. Groundwater, the biggest culprit. Folks living in endemic regions consume highly fluoridated water daily without realizing it. Everyday consumption. Tea leaves, notoriously rich in fluoride, marine fish and seafood. Dental products. For children, the danger often lies in swallowing fluoride-laced toothpaste and dental gels. Industrial exposure. Inhaling dust in aluminium factories, glass industries, or brick kilns can silently add to the daily fluoride burden over the years. The biological pathway. Intake. Slow, continuous excess intake over years. Absorption. A massive 75 to 90% is rapidly absorbed in the gastrointestinal tract, especially on an empty stomach. Distribution. It is distributed via the bloodstream and begins heavily storing itself in heart tissues. Toxic effects. Excess fluoride critically damages amyloblasts, cells that form dental enamel, and osteoblasts, the builders of bones. It fundamentally messes with mineralization and collagen production. Storage. A staggering 99% of all absorbed fluoride gets permanently locked away in bones and developing teeth. Only 1% remains circulating in blood and soft tissues. 3. Clinical manifestations. Let's see exactly how fluorosis alters the human body. There's a stark biological contrast between dental damage and skeletal damage. Dental fluorosis. When it strikes, a during specific window in childhood, from birth to age 8, while permanent teeth are forming. Once tooth development is finished, you cannot newly develop dental fluorosis. Effects. Excess fluoride makes the enamel porous, leading to white patches, severe brown staining, and eventual pitting. Skeletal fluorosis. When it strikes, a lifelong threat that develops slowly over 10 to 20 years. Effects. Biologically, fluoride swaps out hydroxyl ions in your hydroxyapatite crystals to form fluoroapatite. While this makes bones look thicker and denser on an X-ray, functionally, they become rigid, less elastic, and as brittle as a dry twig. Symptoms. It calcifies ligaments, leading to extreme joint stiffness and chronic pain. Non-skeletal effects. Long before skeletal changes become obvious, excessive fluoride silently attacks soft tissues. Symptoms: chronic nausea, severe muscle weakness and fatigue, nerve tingling and sleep disturbances. Organ failure. Most worryingly, it causes a decline in kidney function. Since kidneys are responsible for removing fluoride, their failure traps even more of the toxin inside the body. 4. Diagnosis. How do we actually identify the damage? Grading severity. Dean's classification. Dental professionals rely on a visual index called Dean's classification to grade dental fluorosis. Normal, glossy, smooth enamel. Mild, mild opaque white spots. Moderate to severe, large brown stains, a completely rough surface, deep irreversible pitting, and marked cosmetic deformity where teeth become fragile and prone to chipping. Diagnostic protocol. Grading the teeth is just one piece of the puzzle. A proper clinical diagnosis demands a multi-layered approach. Medical and residency history, asking where the patient lived and what water they drank from childhood. Dental examination. Dentists look for symmetrical enamel defects. Radiology. Radiologists check X-rays to spot osteosclerosis or abnormal bone thickening and heavily calcified ligaments. Lab tests, checking urinary and serum fluoride levels plus kidney function. 5. Treatment and prevention. Managing the irreversible. There is no cure, no medicine or magic pill can pull out deposited fluoride from your teeth or bones. Medical professionals focus on two things: stopping further exposure and managing existing pain. Nutritional defenses. A balanced diet can act as a biological shield. Calcium competes with fluoride absorption in the gut, found in milk and leafy greens. High calcium intake means less fluoride enters the bloodstream. Protein supports tissue repair. Vitamin C, vital for collagen formation, which fluoride disrupts. Magnesium supports normal, healthy bone mineralization. Community prevention. Nutrition is only a secondary defense. The primary battle is at the water source. Safe drinking water. Switching to water sources below 1.5 mg per liter is non-negotiable. Interventions. Investing in rainwater harvesting, utilizing household defluoridation filters, and setting up regular, reliable water testing programs. India's burden. India carries one of the heaviest burdens of fluorosis anywhere on the globe, largely due to naturally fluoride-rich groundwater. Affected regions. States like Rajasthan, Gujarat, Telangana, Andhra Pradesh, Karnataka, Tamil Nadu, Odisha and Uttar Pradesh are heavily impacted. The crisis. Millions of people, especially in rural populations, are unknowingly drawing highly toxic water directly from the earth and using it for drinking and cooking daily. Conclusion. We've seen the science today. From damaged ameloblasts to rigid, brittle bones, we know for a fact that fluorosis is entirely irreversible. But here's the silver lining. It is also 100% preventable. So a rather urgent question. Do you know exactly what is in the water you and your family are drinking today? Is it acting as your biological protector, or is it slowly, silently causing harm? Stay curious, stay informed, and please stay safe.
Thank you for watching Science Force.